Good afternoon, everyone. I know some of you do not have access to the microphone. So just to kind of explain this Zoom feature. What I'm using right now is a Zoom webinar function. What Zoom webinar does, it allows me to host up to 500 people on Zoom. I also have the ability through Zoom, it's more presentational format with the webinar. So this is gonna be more presentational format, so you won't have access to your microphone. I have a couple people who are on the panel. My screen looks a little bit different only because I have the PowerPoint open, so I really can't see who's out there, how many participants are present right now. So what I'm gonna just go ahead and do is, I will be starting on time, but just a quick update on some of these features that you may have that you have not previously had is this. What you should see on your bottom of your screen is you should see a Q&A function. The Q&A function basically allows you to ask questions. So you can ask a question. There will be, I think I have access where everyone can see the question that's being asked. And if you have a very similar question per se, let's say somebody asks, well, are students going to be required to wear masks in schools? You could type in that question. And if you had a very similar question, you could click the thumbs up button and it basically upscales the question. So it would allow me to understand or get a better glimpse of the questions that are out there and being asked. So definitely make sure you use that question. I have some administrators on this panel also that you'll see. You'll see Tim Baker, you'll see Justin Clark, you'll see Melinda. What you'll see them do a lot is they will try to answer some of those questions live in terms of responding as you type the question if there's a specific answer. I'm hoping that by the end of this presentation, I will have answered a lot of the questions, but I'm also giving you a heads up that there are going to be some questions that I do not have the answers to. So when I get to that portion at the end of this meeting, what we're going to do is we're going to collect all the questions that we don't have answers to. We're going to submit those to our district office. And as a district, we're going to create a type of Q&A document where we could best answer some of those questions. Some questions may also be specific to the individual, so we won't really be addressing those, or maybe specific to the curriculum and instruction. And those questions are also going to be answered more in the department format. So if your question isn't answered today, definitely ensure that we will be reaching out to you. And I know some of you who submitted the Google document with questions, some of the administrators reached out to you specifically. Seems to be some concerns. We just want to make sure that we touch base with you and we're able to best meet your needs and best address your questions also. So again, if you leave out of this meeting, rest assured we're going to answer your questions. If you don't have a response in a fairly timely fashion, then definitely reach out to us again and we'll do our best. Okay, so again, to clarify, you have a Q&A function, type up your questions in there, and again, we will get to those, okay? So, having said that, let us begin. This is our reopening plan 2021. I know that Dr. Harding sent an email out on Sunday, and many of you have had an opportunity to look at that document, read some of the details of the plan, but I understand there's still some questions regarding it. And I know sometimes when we're reading documents and we have a focus specifically that we're trying to look for, we may glance over some of the information that was presented. So today's presentation is going to be more of an overview of the entire plan. I'll go into some of the specifics. The specifics I'm going into are the ones where I see questions being asked. And I'm not saying, hey, you should have read the document, but at the same time, I'm going to go over some of those components that it seems like some people miss. So just so we have some clarity into our phases of our reopening plan, which there's two, phase 1 and phase 2. I'll talk a little bit about remote learning, blended learning, and I definitely will dive into some of these safety guidelines and procedures that we have. And again, there are other questions that arise with the reopening plan, and I'll try to address those as best as possible. And those that I can address, I will definitely look into it and definitely get back to you in the near future. All right. So again, first of all, welcome back, I guess I can say. I mean, I know it's still some time before the school year starts, but these are important times. There's a lot of concern and a lot of uncertainty. I know some of you are feeling anxious. I've been feeling anxious ever since March. So I definitely understand some of the feelings, and I know there's a lot of personal, you know, issues that I think we're all dealing with. You know, we can say we're the adults in the building, but we also suffer from anxiety. We also suffer from stress. And I think part of it is not knowing what's going on, and part of it is not really understanding specific procedures that are being put in place. So I definitely want to acknowledge that. And, you know, and I think as a group, we have to really work together. And I think not only to create the best platform instructionally for our students, but also the best platform for ourselves, because when we look at our social emotional wealth, we also suffer from that. So we need to really work together to cope with some strategies and some ideas on how to navigate all this stuff. Like, for example, one of my brother-in-laws is just completely losing it. He's also a teacher. And I told him he's got to stop watching TV, you know, and all the news. He's just constantly on CNN and all these other stations. And it's really affecting him. And so we have to really work together. And here's the weird thing about this, and this is why I chose this picture. And those of you who know me know I like to choose pictures for specific emphasis. And this for me is really telling, because I think when we all got into our fields, whatever field we decided to go into in Eisenhower, whether you're a teacher, social worker, counselor, whether you work in our maintenance department, whether you're an admin assistant for us, whether you're a paraprofessional, we entered this field with a specific idea of what this job would look like. And what's amazing about this is that it's just been flipped completely around for us since March. You know, I feel like I got into this to work with students and help students out. And, but this is just really throwing a wrench in the way I could approach this. But what I'm confident about is that I have good people around me, and I have a lot of friends that I know are in this Zoom meeting right now that working together, I know we could definitely accomplish this. And we could make this a better place, not only for our students and our community, but also for ourselves. And I just wanted us to keep that in perspective. So as we move forward, just remember that, you know, when we work together, anything is really possible. So going straight into the plan. Phase one. This is what phase one will look like. The current plan is to go from August 17 to September 4 with phase one, which means this. Teachers will report to their home school at the regular start time. That's contractually obligated. Students will remain at home for the remote instruction from 10 o'clock to 3:15. So if you're picking up the picture here, is that our students are having a late start. They will be starting class at 10 o'clock and ending the school day at 3:15. Students have remote learning on Monday, Tuesday, Thursdays, and Fridays for the first phase, meaning Wednesdays will be separated specifically for planning, professional development, and curriculum revisions. Now, a further breakdown on what this remote learning means, because I know we have different definitions and ideas of what remote learning are. The close of March seemed to be giving us different information, and things were constantly changing. But for clarity purpose, remote learning is phase one. And this is what it means. It means that students are not physically present in traditional classrooms. They are learning at home via the internet. Students will be divided into groups A and B based on their last names. So the process we're using is the alphabet to determine the 50-50 split in each classrooms. Now, there were some questions asked regarding why not just have all students attend remote learning versus a group A and group B at the beginning of the year. One of the reasons for it is we do want to slowly acclimate our students and also our staff. And we also want to bring in some consistency and some patterns for our students where they can execute this way, especially when we go back to face-to-face instruction. So that was part of the rationale behind that. And also, we also felt that there's kind of a little bit overwhelming sometimes when you have a large group of students in front of you. And I believe that with proper training and proper professional development, we could eventually get to the specifics of having these large group instructions and understanding how to use breakout groups and such. But for the first 3 weeks, we don't know if we're confident we're in that specific phase to be able to do so. So that's kind of the rationale behind that. Also, phase one, you're going to see on assigned live instructional days, students will follow their schedules virtually. So that's one of the questions we keep getting. What is that going to look like? Well, when you're remote, you're expected to follow your scheduled time. So if your class begins at 10, you're expected to be there at 10 o'clock. Students will still get that 3-minute break in between classes to get a drink of water, go to the washroom, but they have to report to their classroom on time. So we will be using Zoom. Zoom is the app that I have right now that I'm using. District purchased it, and we will have access to Zoom accounts. And also for phase one, on assigned independent learning days, this is if I'm an A student, for example, I'm supposed to go live in-person instruction on Mondays. Tuesdays are scheduled as my roll days, so they're assigned independent days. Students will require to independently access and complete lessons posted in Google Classroom. So it's a little bit of switch like from the March. We're expecting our students to log in every day. We're expecting our students to complete the work, and we're expecting our students to be on time. So, and the last box is attendance on live days is required during our phase one. Now, to get you a better glimpse of the schedule, what it looks like, we've broken down this visual, Group A and a Group B, Monday, Tuesday, Wednesday, Thursday, and Friday. So if you follow a Group A student, for example, you have live instruction on Mondays and Thursdays. On Tuesdays, Wednesdays, and Friday, you have independent learning. So it's just going to give you an example of how the specific groups are going to work out. I've also provided an image of the daily bell schedule. And again, this information can be found on a remote learning plan that Dr. Harding emailed all staff. The remote learning schedule is 8 periods a day. Students will have lunch, and I'll talk about what lunch looks like later on in this presentation. But as you can see, what the big shifts are for all of us is shortened schedules, shortened class periods. So there's about 37 minutes of instructional time for each class, which means some significant shifts in the way we instruct. We also have passing periods reduced to 3 minutes. And I know there's been some questions about 3 minutes regarding are students going to be able to get in class on time? How about the washrooms? And we'll address those later on in this presentation when I talk about phase two. But these are just things for you to be aware of currently if you were not at this point. The big question I received from all the feedback that was input on our Google Documents was this question. This was the #1 question. Why do we have to come in for remote learning? And I understand. I mean, that's a pressing question. It's burning on everybody's mind. But what I want to do right now is I want to refer you back to Dr. Harding's email. I pulled this language specifically from his email. So I'm going to give you about a minute to read what Dr. Harding said. So, because I think we got the answer back on Sunday, but I'm not sure we're on the same page on this one, but I'll let you read it for about a minute. So one thing I definitely feel is important to note is that we are all part of this organization. We're part of the same district, District 218. And there are definitely decisions we're going to be fully happy with and some that we're not going to be so fully happy with. In this specific case, the decision was made that when we work face-to-face, collaboratively in the specific building, we believe we are better and we could be more effective. And we could really design our instruction and we could really go into these specific phases in a more effective manner when we're all together collectively. But having said that, my words or showing you these specific words on this PowerPoint doesn't, resolve your concerns or ease your questions. But at the end, we're all professionals. And I understand that when the expectation is that we are asked to come in the building, we will abide by these expectations. These decisions were also made, and I want you to understand, with acknowledgement that we have specific concerns, and there are also areas where many of us are battling with right now. For example, who's going to take care of my child? I know those questions have been brought up, and many of us sitting in this specific room have similar questions regarding childcare and the fears, anxieties about coming into a specific building. But being essential, it's definitely something that we are required to do, is be in the specific building. And some of these areas, I definitely hope that you were able to address some of these concerns regarding childcare and some of the concerns you have at home. But moving on, I'm not going to dive into that question too much. Some other questions that really popped up a lot in phase one was student attendance. Yes, we addressed that when it's going to be required at the class, when the class is scheduled. The daily bell will be followed, expected to be on time. And grading also is something where, the difference between the last attempt at remote learning is that there were specific days, specific guidelines that the state were giving us regarding grading and what can count and what shouldn't count and shouldn't affect student grades. This is a whole different approach now. We are trying to take a traditional form of education and practice that we've always done, education and teaching our kids, and trying to attempt to do it in a hybrid model, which is remote learning and split face-to-face learning. So it's a big shift for us, but our students will know, we're communicating with our communities, that grades will count. We will be informing our students regarding the expectations, not only in the classroom, but also in terms of safety is concerned. Moving on with phase one safety. Again, we're talking about the remote learning safety at this point. What I can share with you is that the biggest concerns that are coming from the forum, aside from why do we have to be here on remote days, is will my colleagues adhere to safety guidelines? For our first phase, I think we're more scared of each other than anything else. And what I want to just communicate with you at this point is just some of the practices we've put in place at this point to ensure safety. We are going to limit the mixing of students and staff, which means we're not going to have these big meetings in the auditorium. We're going to really watch our spaces because we do want to limit the number of people in the same rooms, in the same type of spaces. And we're talking about just these mass gatherings that we've had before. We want to maximize the distance between staff. If you've walked into the building, you've seen that we've taken some precautions in the specific offices to really increase the distance between our staff members. So we're following the CDC guidelines. We work with the Illinois Department of Health to really ensure that these procedures are taking place. And at the end, I'll talk about how it's also your responsibility to ensure that these practices are taking place. One thing we're going to do is we're going to show that no visitors, no non-employees are present in the building. So, and I think this is also goes for some of the questions like, can I bring my child to work? Absolutely, we won't be practicing that. We need to limit the building specifically to our current employees who we know are specifically trained in safety protocols and specific measures. Anybody who's outside will be by appointment only. Those are the things we're going to be following as soon as we start the school year. We are going to establish a system for self-reporting and or possible exposure to COVID-19. Now, again, one of the things that kept popping up is, well, what's the system for self-reporting? How do we go ahead and do so? And those are something that we will be releasing pretty soon. We will have to release it before all staff come in for Institute days. But basically what it comes down to is going to be a checklist. And that checklist includes information. If you've had a fever, do you feel you have a fever? Do you have a running nose? So it's going to be a type of information that pretty much gives an indication if you have any of the symptoms specifically of COVID. Another question is going to be asked is, for example, if you've traveled out of state to any of the hot spots. So I would caution you on this one also, because if some of you are planning to take children to college, to Texas or to Florida, Illinois has a quarantine requirement which you will be expected to abide by. So in this specific sense, it's important for you to really self-monitor and communicate that information with us on a regular basis. Now, the questions that also have been brought up to, for example, is what happens if one of my students or one of my colleagues has COVID-19? They've been here for a couple of days and they were diagnosed with COVID-19. So what you're going to see is shortly, because we're still working with the Department of Health, we're still trying to get that information, and we want to be specific with those procedures. So I'm not going to present those to you right now. That is going to come out from Human Resources, specifically about here's the specific steps that you take. If you, for example, were diagnosed with COVID-19, here's the specific steps. And then once we get that information, here's how we're going to communicate with staff members. So again, and I just want to reiterate, all the cases that if we have any, we're going to be working with the Illinois Department of Health. So it's not something we're going to do in isolation. And it's also something we're planning on working with our health professionals, our current nurse, in terms of communicating and creating these procedures that work for our building. So somebody asked about testing. Are we going to be testing students? We're not a testing site. We don't have the personnel to be testing students every specific day or staff member. Questions at quarantine time, again, that's something that will be communicated by the district level to all buildings. What do we do? Cases notification of COVID-19? Definitely, if you have something right now, you communicate with us, but there will be specific procedures and guidelines that are established. And self-certification, of course, those forms will be coming out soon, and it would be a series of questions where you self-certified that you do not have any of the symptoms or attended any of these hotspots of COVID-19. Number of questions have been brought up about sanitizing and disinfecting. We're going to engage in daily cleaning. Classrooms, you'll see the building's availability of wipes, disinfectants, hand sanitizer. We will be providing those, and we are actually in the process of trying to get more of that material. Some asked if you could bring your own materials from home. You're always welcome to bring that from home, but we will definitely have that and be able to provide those for our staff members. Now, there's questions also about like Wednesday. This is a deep cleaning, and should we be in the building because we're using these machines? Just want to clarify that we're cleaning the buildings as best as we can with the resources we have. There's an idea out there of a deep cleaning, which seems to, for me, a little bit confusing, because it's like, if you tell me about a cleaning the room versus deep cleaning the room, there's, what are we doing specifically different that requires this whole idea of deep cleaning? We've been practicing the guidance according to CDC and the Illinois Department of Health, and we're confident we're on procedures. So we're gonna keep doing it on a regular basis. When people heard about the fogger machine that we have, that's something that we use at night, not during the day. We've always used it at night. So, when we say when students are present, that's what we meant by that, is that our nighttime is usually when we have these type of cleanings. And at nighttime is usually when we're able to get into classroom a little bit better. There's been questions asked about who's gonna clean in between classes. Look, as we said before, limitation of personnel wise, there's no way we'll be able to clean every specific classroom after every class is gone. What we're gonna have is, again, the wipes, the disinfectants available. So if students wanna clean the specific areas, if teachers wanna clean those specific areas, if paraprofessionals wanna clean their own specific areas, you'll be free to do so. Now, concern about masks. Will our staff receive masks? We're going to distribute a reusable mask to everyone, one with the Eisenhower logo. And, for the most part, most of our staff have masks at this point. However, what we're going to have also is the availability of disposable masks. We know one thing that happens for sure. You come in at school with a mask and all of a sudden the strap breaks. So what do you do in that specific situation? We're going to have some extra, some disposable masks that you can definitely use. But one of the things is this: if you have your own mask, feel free to use your own mask. We will be giving everyone Eisenhower Cardinal mask, but you can bring masks. And I would always say, have multiple masks available. One thing we're also doing with phase one is modified spaces. So those of you coming in, you'll see that in some areas we'll have some plexiglass. For example, our highly trafficked areas from the public, like the main office, our support staff will be looking at ways of using plexiglass when they're meeting in close proximity with specific students. We're encouraging the use of open spaces. We're encouraging the use of really a different way of meeting with groups of specific students. And, you know, we're using any room and all spaces that are at disposal at this time, which also answers the question if I'm going to have my own room. It's so hard to do it in this specific case. For example, if we have a case where we have a student that maybe reported symptoms of COVID, we're going to have to really go in that room, completely sanitize that room, but we'll also probably be shutting that specific room out, which would mean that we're going to have to do on-the-fly type of room relocations. So, so no space is sacred in that sense. No one has their own specific room. In terms of the HVAC, we have increased the outside air ventilation. We're fortunate enough here that we have windows and we'll be able to open those specific windows. I know there's some concerns about, well, what happens if bugs get in the room, or if it's too hot, or if it's, or the traffic. Those are things we're gonna have to navigate with. So, so there's definitely not an easy answer here. Some are gonna be easier than others, but those are some things that we're gonna have to work in and you're gonna have to work with us. Also, phase one, staff expectations. And I think this is the biggest one. All staff, students, and visitors will be required to wear face masks all the time when you're in the building, with the exception of eating or drinking. I know that there's been some discussions about, well, what if I'm in my room by myself? Yeah, that's a different story. You know, you're not exposed to other people. But I will reiterate this point. You may feel comfortable walking to school and being in a meeting and taking off your mask, but your colleague may not. So that's where you really have to be comfortable with having a conversation with your colleague. I would say that even when you're working in PLCs and departments, establish some groundwork with your teams and saying, we're all gonna agree to wear a mask in these specific spaces. Because if we don't do that, then there's some confusion that arises. And I know there's many of you who have different opinions in this. There's many of you, like I said, who are really, really freaked out about this, having gone out since March. And there's some who are a little bit more comfortable, who have traveled a little bit, gone to restaurants and such. So there's a different level of comfort level, and there's different ways we're all approaching the situation. But it's going to be specifically on the adults of this building to communicate and talk together regarding our approach in this classroom. One thing we will be enforcing as administrators is the mask. You are the examples of our students. We need to see masks at all times. So having said that, self-certification is critical also. Again, as I said before, this is a document that we're trusting everyone to answer honestly. I know there's questions like, what if I think I'm sick? What do I do in that specific case? And I know there's going to be situations potentially if you're out of sick days and you have the sniffles, you're like, but this is sniffles, right? So what do we do in this specific case? That information will also be coming from human resources in terms of identifying your symptoms and what to do. And in cases where you're not sure of if you're sick or not, what to do specifically. So we're getting a little bit more clarity on that one. But self-certification is critical. And again, I say, travel restrictions apply and your colleagues know. I can't tell you the amount of emails I get from staff members saying, did you know so-and-so went to Florida? So, you know, in terms of certification is concerned, you know, I got to ask that question. Like, if you're self-certifying and saying, no, but I'm getting information that you've been to these hotspots, it's a question that I'm going to have to ask. And what I mean by your colleagues know is with the anxiety that's present right now, you better believe that, you know, individuals will be sharing information that they feel poses them at risk, okay? So I just want to throw that out there. And the last piece. Last year, we had a meeting about collective responsibility. And I think when when rules and when procedures falter is when we lack this collective responsibility. What I'm telling you right now is that safety is going to be our priority as we move into these phases. And it's all of our responsibility, which means that if we're pushing students from the hallway and not congregating, it's your responsibility to usher those kids away, usher them into the specific classroom. If a student's not wearing a mask, it is your responsibility to tell them to not wear a mask. If the student refuses, it's your responsibility to document and communicate with administration when that's not happening. If you feel the same about your colleagues, it is your responsibility to inform your colleague and also address institution-specific matters. We are in this together, and I think if we work on this and we agree on this together, we could definitely ensure that our students meet the guidelines, and also our staff members and our colleagues meet the specific guidelines. And I think we have an example to show from that. Our graduation in July went well. The kids listened. They abided by specific rules. So did our community members. We didn't have any specific issues regarding students not in compliance. So we have some small samples where we know it can happen. Phase two, now I'm going to phase two. Phase two is, again, blended learning. So just so you know, this starts September 8th. That's our targeted date. But I want to clarify, the district has built this into phases, and they reserve the right to extend phase one as needed. And many of you are probably thinking, what do you mean as needed? Again, it is with complete communication with the Illinois Department of Health. And situations where you see, for example, specific areas where we see a high outbreak, I could guarantee that there's a good chance that the phase will be extended further. So just want to make sure that I communicate that. But phase two, when we do see live instruction, is going to be a mix of 50% of the students learning on one day and 50% learning on Schedule B. So we have Schedule A with 50% of the students, Schedule B with 50% of the students, okay? Students A, is, if you recall the schedule I provided, would be on Mondays and Thursdays of live instruction. Students of Schedule B will be on Tuesdays and Fridays with live instruction. Students will be, again, in attendance 10 to 3:15. Teachers will use the first hours of the workday and Wednesday for planning and curriculum work. And again, I want to emphasize this point. We're one of the few districts that did build in that specific professional development time in the morning and on a Wednesday because we believe in this highly. And again, just throwing this out there also. We have a couple of weeks before September 8 hits, but there are going to be some positions that we will be looking into repurposing. If we feel, for example, that we're not going to have specific sports this year, we will be looking at different positions and reworking those specific positions. Phase two, again, I'm just going to read this verbatim, what this means. Students will remain in their assigned group, either Group A or Group B. We're not going to be mixing these kids. If I can make my Monday because for whatever reason, can I come on Group B? No, you cannot. Students, groups will alternate between in-person instruction and school and independent remote learning at home. So some kids will be in school, half the kids will be at home. We will be using Google Classroom. I will emphasize those of you who are using iTunes U to really convert to Google Classroom. After 1 year, where iTunes U will no longer be available. So, so please convert to the Google as soon as possible. Wednesday is an independent remote learning day for all students. On in-person days, students will follow their schedules while adhering to, of course, our guidelines. And on remote learning days, students will be required to access and complete lessons posted by the teachers in Google Classroom. Again, just an example of the schedule that we have here for a Group A student and Group B student on those blended days. And you see the in-person instruction on Monday and Thursday for a Group A student. All right, moving on. Phase two, safety. And this is where we got most of our questions. Again, there was the safety concerns for phase two. Again, what I'm going to reiterate is we're going to have school-wide cleaning and disinfecting. Throughout the day, what you're going to see mostly is common areas. For example, your restrooms, your lunchrooms, your doors. I spoke about the classrooms already, about questions about how we're going to disinfect after every class. I've addressed that question already. We're going to limit the mixing of students and space utilization. So in other words, we're not going to have a large number of kids in a specific area. We're really trying to contain some specific areas to less than 50 kids. We're talking about specifically like a lunchroom per se. What do we do at a lunchroom? Well, we're going to have to limit spaces. We're going to create multiple lunchrooms to be able to handle just the larger number of students. A/B schedule is specifically designed to limit the number of students in each classrooms. There'll be some communication with us, of course, because we're trying to make sure that we're going to balance these schedules, and we're going to think that everything is fine, but your communication is going to be critical with us for these specific schedules and this balancing once it's completed. We're going to require assigned seatings for students. Typically, it doesn't happen in high school classrooms, but the reason for assigned seating is because if we do have a student who has symptomatic or is diagnosed with COVID, we need to know who the people or the students around him were. So assigned seatings is going to be a must. And these are, again, things we're going to communicate with our students and families. Some classes may be temporarily relocated. Just so you know, and those specific teachers who have concerns currently with classrooms. We know about band, choir. I know you've already worked with your curriculum director and have contacted Melinda. I would say I would do the same for other teachers who have similar concerns. Work with your curriculum director, work with Melinda Majek on that, because some spaces we do have to really think about. Non-essential furniture, couches, etc. These things that if you own these, we need to remove these, because what we were trying to do in these classrooms is trying to remove furniture and create more space for our students and for our teachers. So if you have items that you need to remove, let Melinda know. Melinda is, as you know, in charge of operations in the building. So please communicate with Melinda Majek, Dr. Melinda Majek, regarding the removal of furniture. If you want to keep it, let us know. You have got to pick it up, because on our end, we're going to toss things. And we probably will send an email regarding, when to retrieve your things by, but we got to free up those spaces. Some classes with 2 teachers' desks, we're removing that. We're going to go to 1 teacher desk, because we have to maximize that specific space. And I know some of you may not be comfortable with that, but we've got to maximize the space as much as possible so we can spread out the students. Let us know ASAP, please. Some had questions about microwave and refrigerators. Bring them in the classroom because you don't want to share common spaces. I want to remind you that certain procedures that we have and certain policies remain in place. Just because we are worried about some of the common spaces doesn't allow us all of a sudden to, again, break different guidelines and bring microwaves and refrigerators to the classroom. And I'm a big believer right now, and I'm telling you right now, don't bring anything from the outside at this point. We're trying to clean up spaces. Don't bring any materials. Those of you who are concerned about, like, well, where am I going to put my lunch? You're going to have to buy like a little lunch bag that has a cooler. I mean, if that's one of the concerns. A couple years ago, we gave some nice little lunch boxes for our staff. I don't think it'll fit much in there. Probably fit a can of pop in there, but we might have some extras too. But we have to really get creative with those specific items that we bring. Plexiglass barriers, I've got a flood of emails, people wanting this and that. We've got to be very careful about what we order and the effectiveness of these items. And I think it's right now, there are companies selling you everything right now, but delivery, for one, is not guaranteed. You could order some stuff right now and it's taking months to get. We're going to place barriers where appropriate. For example, some teachers have asked about what do I do with small groups? Well, we've got to get creative with those small groups. We've got to figure out a way of different interaction with students, because you can't have small groups and social distance at the same time. The plexiglass barrier is not going to do much for that. So we've got to really be creative in terms of the way we're grouping our students, how we're working with the students, our offices. Again, it's creativity. It's again, if you have access to your window, open your window up. It's about using different spaces, open spaces when available. And crying students, you're gonna have crying students. There's no doubt about it. And how do we handle that specific student? That's again something that we have to work with. But again, you're the professionals in some of these areas, and you've got to communicate with us also. But I also think that just based on some of the information I'm getting is that you can also help with some of the solutions. You know, when we're looking, for example, in some of these specific areas, it's okay for you to say, hey, I've been thinking about students in this area and crying and how that might be ineffective and how particles get in the air. I was thinking of doing this. We're always open to this, and I think we've been very collaborative with our staff. Where if you have ideas, we'll work with you on ideas. But there's so many areas that we're looking in right now that to give all this information to a few individuals to solve is going to be hard. That's why that Q&A is important for us, because once we have this information, we're going to be working to try to answer every question. But there's still going to be some holes that we haven't thought about. So your cooperation and your communication is going to be extremely important. Again, phase 2, safety. So again, I'm talking a lot about the safety, so you could have a little bit of clarity of what we're trying to do. Sharing of materials. There's some departments who are concerned, oh, sharing of material is bad. So what do? Again, you're working with your curriculum director, communication, and you're working with Melinda. Many of you have already had those communications at this point and have already had some of those responses at this point. Some are in the work. If this is the first time you're thinking about it, that's absolutely fine, but I can almost guarantee that some people in your department already asked that question. So that sharing of materials will be definitely addressed with your curriculum directors and, again, Dr. Majek. Monitoring student movements. Some questions regarding that. Yeah, we're monitoring students' movements. Washroom documentation, we'll work on that plan specifically, because some are asking, well, how do I monitor students' washroom? I think the process can be confusing if we've never addressed this process, but I think also when in terms of teaching is concerned, we should always know where our students are at. But we're going to create something that hopefully helps some of you who are wondering how we're going to monitor these kids going to the washroom. Because one thing is for sure, if we have the same students going all the time, we need to be aware of that. And we need to be aware where they're going. Just so in case, you know, there's an issue, we know who to address it with and how to address it. Limitation of students passes, well, that's one thing we're definitely implementing. Our counselors, our social workers, our administration, we're going to communicate with them about limiting the number of students we're pulling out for class. First of all, they have limited days live instruction, so we want to minimize the amount of time we're pulling them from specific classes. We're also trying to use IEPs and 504 remote leads with our families so they don't have to come in. So those are some things we're trying to implement. Field trips have been canceled. There's no field trips, there's no assemblies, and no in-person school events. For example, parent-teacher conferences, open house. Those have all been canceled in terms of them being held live. Access to nurse's office is going to be limited also and managed, and those will be communicated. I know Nurse Featherstone has been working hard on many of these items, and it's not going to be like we've done it before, where if a student is sick, go see the nurse. There's going to be some specific procedures in place. We are going to have a quarantine room specific for students who may be exhibiting symptoms or an area specific to really address and identify their needs before sending them to the nurse. So that's going to be a work in progress, and when that's completed and done, we will definitely be communicating with you. No lockers. I know we put that in that plan. There's going to be no lockers. Some of you are wondering what are the kids going to do in winter. They're going to have to carry their stuff at this point, because one thing we're doing in lockers is that we know that lockers create more issues in terms of students congregating and breaking these barriers of social distancing than anything. Sharing lockers. So we're eliminating those specific lockers. And if we feel the need, as the school year goes forward, we may have some kids that we allow to go to the locker. But at this point, the current plan states that we have no lockers for students. Even in gyms, also PE, just so we know, we're clear. PE also no lockers there, because those are very tight spaces. And again, in order to eliminate students close to each other, we're not allowing them to use the lockers. Lunch plan, again, it's going to be grab and go. There's not going to be this buffet style. No outside food will be allowed. We're not having anyone drop off any specific food or items. No vending machines. Portable sinks in the eating areas. And as I said before, we might have multiple lunchrooms that we use this year. And the water fountain function will be shut off. So the actual water fountain will be shut off. The bottle function will still be used. But again, this is eliminating just the constant use and congregating around these specific areas. Phase 2, continue with safety, student expectations. This list will grow a little bit as we work with more teachers on this. And when if there's areas that I forgot, I apologize. I was creating this today. So, but we're going to, again, is push a couple points home. We don't want anyone in the hallways, no congregating, no waiting for your friends to come. None of that stuff is going to happen. But again, for this to happen, we need everyone's support. Students must wear masks at all times. There's no exceptions on this one. And we're gonna push it, and we're gonna work with our families as we always do. But absolutely, this is something that is going to be enforced. And I guarantee you, when we work together, we can make this happen. Self-certification for students. I know there's been questions about how students are going to do that. I know the state is creating an app regarding self-certification, and there are some other apps available. We're currently in the phase of deciding where we want to go with this one. But currently, the plan states that students would self-certify. They've got to self-certify before getting on the bus, and they got to self-certify again before entering the specific building. So we're looking at self-certification there also. There may be an element where we do some random temperature checks. But the debate is this: even the latest CDC guidelines have kind of, put us limitations on the effectiveness of some of these procedures, like temperature checks. As some of you are probably aware, are sometimes not very accurate. You could be asymptomatic and not have a fever, or you could have other symptoms and not have a fever. So, so for us, it's going to be mostly about that sort of self-certification, speaking to our students, training them, asking them what signs to look for, and with proper education and communication, we're hoping that our students be knowledgeable and be able to identify issues before we see a mass spread in the building. Social distancing, we're going to be enforcing proper hand washing. And I already talked to you a little bit about some things in the class, and we will be doing is assigned seating. Phase 2 questions. So again, some of the key questions that we've seen: what happens if students refuse to wear a mask? Again, it's going to be something that we're definitely enforcing. We believe in safety as a priority, so we definitely have to enforce this. Phase 2 questions: what happens with students with no Wi-Fi? We have hotspots available, and our support staff will be working with specific families to ensure that they have Wi-Fi internet access this school year. Material distribution, there's been some questions about handing out material, collecting material. Dr. Majik will be sending out a plan in terms of collecting materials from last school year and how we will be distributing materials this specific year. I would say when the first few weeks of instruction, we just got to be cautious that some material may not be available at this point. And what I mean is that specific textbooks that were given to students and haven't been returned. So what I would do in terms of material that's necessary, work again with your curriculum director in terms of the materials that is out there that has not been returned, and they will communicate with us, and we'll definitely put a plan in terms of getting that back in the building and redistributed. A lot of curriculum concerns, and I get that. But again, your curriculum directors will be working with you specifically. I know a lot of you have done a ton of work in summer. I mean, that doesn't go unnoticed, trying to really address how you're going to start a specific school year. So, and I know some of your colleagues will be able to help you with some of these specific concerns. And there are also instructional concerns. One thing I can tell you with instructional concerns, again, we'll be working with you in the building specifically on just the digital portion of instruction, what that specific day looks like. But again, your departments will be working with you on this also. I know we have some embedded training those first few weeks, Google Classroom, Zoom training, and such, to really help you prepare how to teach in this digital world, in this remote world. A few more things just before you go. August 10th and 11th, just so you're aware, we're having the class of 2024. We will have freshman orientation in the building. It's going to look a little bit different this year. What we're planning on doing is bringing in our students and running them through an hour of just tech training, how to use their specific iPads, get on Google Classroom and such. And we will also have another specific hour of training of really who to go to in specific situations. We're going to lay out some behavioral expectations, how to engage remotely. We're talking about safety instead of putting it in their minds on those specific days. So we're going to be distributing iPads. So our freshmen will have it by the 11th and be ready to go when we start remotely. August 12th to 14, it's only staff members in the building. Again, the trainings we have outlined so far is Google Classroom, Zoom, Google Voice training. There's going to be a lot of department time, safety training. Department time, I think, is going to be critical, especially how you set up those Google Classrooms and how you communicate those with your students. So there's definitely a lot of time built in for that. And Q&A document. There's some questions that I know some of you are waiting for me to answer. For example, what does FMLA look like? What about the CARES Act? What happens if I get COVID? What happens to my sick time? And again, as we said, what are the procedures if I get COVID or if one of my students get COVID? What are those procedures of communication? That is something that is going to be coming out from our district office. So it would come out, I would say, relatively soon. I mean, we're starting back in a couple of weeks. So that's something that's going to be out there. I don't want to jump the gun and speak in this one. I'll let the formal response come from the district, but those questions have been noted and they will be addressed, and we have submitted those to the district office to provide some clarity for our staff. All right. And in close, I just want to close with this, is that we definitely can make an impact on this. I know it's not the ideal situation. As I said before, it's different from what we signed up for. But if we work together and we work to enforce the specific rules, procedures, we can make an impact on this one. And I know I got young kids going back to school also, this split schedule. And I hope that, the educators in their buildings will definitely work with them to keep it safe and provide an engaging year as much as possible in this environment. So I know we could do it. I know one thing I always say about Eisenhower, I think everybody always steps up, and it's a great place to be. I think we can do the same thing, but I think we have to look out for each other at the same time. And in terms of the meeting is concerned, the overview of the meeting is over. What I'm going to do right now is I am going to stop sharing my screen, and I will go into some of the Q&A. So I'll let the other administrators who are on the panel kind of answer some of those questions that they have not been answered, okay? Because I have not been able to read everything. So I will stop sharing my screen and I will let them speak.
Hello, everyone. At this time, most of your questions that you've been submitting through the Q&A have either been answered by an administrator. We know that many of you logged in right at 1 o'clock, so we don't want to keep you for much longer, but your questions should have been answered. Otherwise, you all know that at any time you are more than welcome to email any administrator, and we will do our best to get you information. There's a lot that Erik has gone over, so we know it'll take some time for individuals to digest it and apply it to their individual situations, and then maybe have additional questions from there.
And thank you. We'll stay on, answer any questions if they pop up here, but the meeting is pretty much over, and thank you for hearing me speak for an hour. This is crazy. I spoke for an hour, so I won't be able to speak tomorrow, but I appreciate you attending this meeting. So you can definitely log off. We'll stay until the end. We'll be the last ones on, so if there's any other questions, feel free to ask it through our Q&A session or even the chat. Thank you. I think the webinar is kind of interesting. I mean, you can't hear anybody speak, so you just hear yourself. So it's a little bit different.
Yes. Do you want to close out of this and let's do another Zoom to debrief, or it's up to you?
Yeah, that's you're asking me?
Yes.
No, we will see. We're staying on until
There's still
everybody
questions? Okay.
gets any questions, you know.
Perfect. Just
So
wanted to double
we'll
check.
stick to the end. Yeah, we got some time. We'll stick to the end.
Great. Thank you. I'm going to start answering some of these questions. I'm sorry.
We're not getting any more Q&A, right?
Yeah, there's still a few.
Oh, I think I just kicked some people out.
It looks like we have four more unanswered questions as of right now. There's about 38 people left. I think the max we had, and there's about 124.
The Q&A. Oh, I see what you're saying. You guys have the function where you click answered versus open questions, right?
Yeah, so once we answer them, it goes into the answered column, so we know we've addressed it.
I got you. I got you.
I'm going to take these last two.
Yep.
Cool.
Sorry, just give me a second. It should be open.
Hey, Eric.
Just,
I think I think you recorded it. So once that gets done, you should send it out because a couple people did ask about that.
I could just say stop recording. I'm gonna stop recording then.
Okay. Well, I would leave it up because I'm guessing they'll be able to see the questions that are answered that Melinda's doing right now.
Okay. I don't know how your screen looks versus mine. Mine, I could just see the panel, and I have the screen, so I'll leave it on until we're done. Do we have a way of printing out these questions too? Let's see.
I wonder if you could just cut and paste it.
okay. Sorry, guys. Maintenance needs me real quick. I'll be right back.
Yeah, I'm not sure. I'm not sure if you go back and watch the video of it, if it goes through and you can go and check the questions live or not.
Okay, so I will leave it on, like, so we can make sure we look at the questions.
For the other ladies, is this one of the slides? Yeah,
we have a cartwheel out here.
Okay, perfect. Let me.
Mute yourself while you're there, Melinda.
Guys, is it okay if I just step away and then I'll jump back in if you guys wouldn't mind texting me when we get ready to debrief?
We'll do a separate Zoom meeting for the debrief. We'll send it.
Thank you.
I think that's it at this point, unless if anyone else, I think the Q&As have been answered. I haven't been looking at the chat, Baker. Was there anything that wasn't answered in the chat?
No, the chat was mostly just technical questions and stuff, so.
Okay.
So what I'm gonna do is I'm gonna start removing people from the.
Yeah, or just end for all.
What does it do to my screen though?
If you, you can kick people out. Otherwise, you can just end the meeting for everybody after you stop the recording, and then.
Okay, let me do that.
Who's going to send the debrief Zoom link?
Okay.
I'll do it right now.
Okay.
Eric, make sure that you save. It's going to prompt you to save your recording. Make sure you do that.
Okay, sounds good.
All right, I'll send it right now.